Good day to all of you. I am Sara Zopdikar from first year BAMS, and today I am going to discuss with all of you the topic infertility. In this topic, we are going to discuss about introduction to infertility, definition of infertility by WHO, causes of infertility in men as well as in women, types of infertility, diagnosis of the infertility, data of infertility cases in Goa, aspect of ART. Firstly, introduction to infertility. Infertility is a significant social and medical problem affecting the couples worldwide. Infertility refers to an inability to conceive after having regular and unprotected sexual intercourse. Average incidence of infertility is 15% globally today. Definition of infertility. Infertility is a disease of the male or female reproductive systems defined by the failure to achieve a pregnancy after 12 months or more irregular unprotected sexual intercourse. This definition is given by WHO, World Health Organization. Now, infertility has risk factors too, which include older age, smoking cigarettes, heavy use of the alcohol, being overweight, history of some STDs that are sexual transmitted diseases, exposure to toxins such as pesticides, herbicides, heavy metals, etc. Causes of infertility in men and women. In men, low sperm count. The normal sperm count is around 20 million sperm per ml of the semen or more. Less than this or less than 10 million sperm per ml of the serum is considered as low sperm count. Also, no sperm, that is absolutely absence of sperm in semen, can also be the cause of infertility in men. Low sperm motility, that is sperms are immotile and cannot swim. Abnormal sperms, unusual shape, more difficult to move and fertilize the egg. In this picture, we can see in the left hand side there is a diagram of a normal sperm, but whereas all the 5 to 6 diagrams on the right hand side are all the images of the abnormal sperms, which can be the cause for infertility in men. More of its causes can be testicular infections, testicular cancer, testicular surgeries, overheating testicles, ejaculation disorders, variocele, underdescended testicles, genetic abnormality, hypogonadism, pumps, hypospadiasis, chlamydia infections, etc. In women, some of the causes can be ovulation disorders, which include premature ovarian failure before age of 40, that is premature depletion of ovarian follicles before age of 40 years. Polycystic ovary syndrome, which is basically a hormonal disorder, causes enlarged ovaries with small cyst on the outer edge. Hyperprolactinemia in non-pregnant state, which is basically higher prolactin level, which can include milky nipple discharge or poor egg quality. Secondly, problems in the uterus and fallopian tubes, that is surgery, submucosal fibroids, which are subseral fibroids projected out of the uterus, endometriosis, which is basically a disorder in which tissues that normally lines the uterus grows outside of the uterus, previous sterilization treatments, and etc. Also, medications such as NSAIDs, which are non-steroidal anti-inflammatory drugs, chemotherapy, radiotherapy, and illegal drugs. Types of infertility. There are two types of infertility: primary infertility as well as secondary infertility. Primary infertility happens when a couple that has never conceived. And the second infertility that causes after previous pregnancy regardless of the outcome. Now, diagnosis of infertility can be done by laparoscopy or transvaginal and ultrasound. Here also we can consider about signs of infertility, which are irregular periods in women or no periods in women, pain during sexual intercourse, too long or too short menstrual cycles. Can be some of the signs of the infertility. In this slide, I have mentioned some of the cases of infertility which I have surveyed in Goa. starting with the woman having her menstrual cycle at a very young age, that is at the 12 years, had her marriage at 24 years, had her first pregnancy at 25 years, but had her menopause at the 44 years. Whereas another woman who had her first menstrual cycle at the same age as of the previous woman but does not get the menopause early, unlike the previous woman. So there are exceptions, it differs from people to people. Another case of a woman who had her menarche at 17 years of age, that is later stage of her teenage. So she had a marriage at 23 years of her age, first pregnancy at 25th year of her age, but still has not got her menopause, as she had her menstrual cycle starting at the later part of her teenage. In this second batch, a woman with 10 years of age had her menarche, had her marriage at 28 years of age, had her first pregnancy at 32 years of age, and had her menopause at a very early age, that is at the age of 40 years. One more benchmark may be at serial number 18. A female with 16 years of age had her menarche. 30 years of age she had her marriage, and 31st year of age she had her first pregnancy, but at the age of 51 she had the menopause. So we can conclude here that females whose menstrual cycle starts at a very young age, like around 10 years of age to 15 years of age, has will have their menopause a bit early. But there are exceptions also. After menarche being so early, their menopause isn't early. They have their menopause at around 50 or 55, but exceptions, it varies from people to people. But from my survey, I have got to know that women having their menarche early at the early age have their menopause also at a very early age, and women who have their menarche at a very old age, around like 18 years of age to 20 years of age or 16 years of age, they have their menopause quite early, or sorry, moving further, we'll talk about ART, that is assisted reproductive technologies. Now here are new technologies which help people or a couple to become pregnant. The aim of ART fertility treatment is to promote the chances of fertilization and subsequent pregnancies by bringing a sperm and an egg closer to each other. Different types are intracytoplasmic sperm injection, that is called ICSI, intrauterine insemination, cryopreservation, surrogacy, gamete intrafallopian transfer, egg donations, and many more. To conclude, when a couple cannot achieve pregnancy after 1 year or more of unprotected coitus, the couple is considered as infertile. The World Health Organization defines primary infertility as a condition when a woman has never gotten pregnant before, and secondary infertility as the failure to achieve pregnancy after one successful conception in the past. There can be multiple causes of infertility related to either male or the female partner or both the partners. Assessment of both the partners is vital. Treatment depends on infertility cause and ranges from ovulation to surgery to ART. That's it. Thank you.